अस्सलाम वालेकुम डियर फर्स्ट ईयर, कैसे हैं आप लोग। इतने दिन हो गए आप लोगों से बात नहीं हुई। हम लोग तो आप सबको बहुत मिस कर रहे हैं, अपनी क्लास को, अपने बच्चों को। उम्मीद है कि आप लोग पढ़ रहे होंगे। इस टाइम को अवेल करें। दिन के 10 घंटे ज़रूर पढ़ें, 6 घंटे कॉलेज के और 4 घंटे वैसे एक्स्ट्रा जो मिलते हैं। तो इंशाल्लाह आपकी तैयारी प्रॉफ की बहुत अच्छी हो जाएगी। आज का टॉपिक हम शुरू करते हैं, फ्रंट ऑफ थाई। फ्रंट ऑफ थाई का जनरल इंट्रोडक्शन। जनरल इंट्रोडक्शन में सबसे पहले स्किन है, फिर सुपरफिशियल फेशिया है, फिर डीप फेशिया है, फिर मसल है, फिर बोन्स हैं। तो हम पहले शुरू करते हैं स्किन पे। स्किन कैसी है? Anterior front of the thigh skin, pubic symphysis is studded with the hairs. बाकी सिंपल स्किन है जैसे आम होती है बॉडी पे। Superficial fascia, it consists of two parts, superficial fatty layer and deep membranous layer. Superficial fatty part is blended. These two layers are blended with the abdominal part, but the deep membranous layers, it is adherent. It is loosely adherent to the deep fascia, but in the upper part with the inguinal ligament, it is deeply adherent, and it is adherent to the pubic lateral to the pubic tubercle about 8 centimeter, which is called a Holden's line, and it is clinically very important. These Holden lines are very important. It is often asked in MCQs. When there is perineal urethral rupture, then the extravasation of the urine passes into the anterior abdominal wall, but it does not travel downward because of the tight these Holden lines, tight layer of the deep membranous fascia, which is adherent to the lateral to the pubic tubercle about 8 centimeter. Then after superficial fascia, then are cutaneous nerves in the anterior compartment. These cutaneous nerves, you can also draw a diagram of lumbar plexus. These cutaneous nerves are ilioinguinal nerve, which is L1. L1 ilioinguinal nerve. L1 is divided into two parts, ilioinguinal and iliohypogastric. Iliohypogastric remain in the abdominal part, which we will study in second year. Ilioinguinal part supply the upper part of the scrotum, base of the penis, mons pubis, and the upper part of the thigh, ilioinguinal nerve. While the femoral branch of the genitofemoral nerve, this is L1 and L2, genital branch of the genitofemoral nerve. Then is the lateral cutaneous nerve of the thigh. It is L2 and L3. And intermediate cutaneous nerve of the thigh, lateral cutaneous nerve of the thigh, again subdivided into two branches, anterior and divided into two parts, anterior and medial. And intermediate cutaneous nerve of the thigh, it supplies central and intermediate part of the thigh. While the medial cutaneous nerve of the thigh, it again subdivided into two branches, which is supplied the medial and somewhat lateral part. While the saphenous nerve is the posterior division of the femoral nerve. L1 gave the ilioinguinal nerve, iliohypogastric nerve, and L1 and L2 genitofemoral nerve. L2, 3, 4, the anterior division form the femoral nerve, while the posterior division L2, 3 posterior division form the obturator nerve, L2, 3, 4. L4 and 5 form the lumbosacral trunk. While the lateral cutaneous nerve of the thigh, it arises from the L2 and L3. These lumbar plexus are formed within the substance of the lumbar plexus is formed within the substance of this muscle, psoas major muscle. This is psoas major muscle, which arises from the lumbar transverse process of the lumbar vertebra and inserted into the lesser trunk of the femur. Substance, this is ureter, and under this ureter is psoas major muscle. Lumbar plexus is formed within this muscle. Ilioinguinal nerve, iliohypogastric nerve, genitofemoral nerve, laterocutaneous nerve of thigh, femoral nerve, obturator nerve, and lumbosacral trunk. And you have to draw this lumbar plexus on your copy, and also this lumbar cutaneous innervation on your notebook. So this one, the lymphatic drainage, and this one, this long muscle is a sartorius muscle. This long muscle is sartorius muscle. This long muscle is sartorius muscle. Femoral branch of a genitofemoral nerve is anterior to it on this side, while the medial cutaneous nerve of the thigh supply this side. Intermediate cutaneous nerve of the thigh this area, and the lateral cutaneous of the thigh, lateral cutaneous nerve this one, this area, and the saphenous nerve, which is a posterior branch of the femoral nerve, which supply from the back of this side to the big toe. Posterior, back of the leg to big toe. This is this is saphenous nerve, which is a posterior branch of the femoral nerve. Arteries. There are three cutaneous arteries: superficial, external, pudendal, which supply the genital region; superficial epigastric artery, which supply the lower part of the anterior abdominal wall; superficial circumflex ileus, which travel laterally and form an anastomosis. Then is a great saphenous vein. Great saphenous vein is the longest vein of the lower limb, begins from the medial end of the dorsal venous arch, which is formed on the dorsal surface of the foot. It runs upward in front of the medial malleolus, along with the medial side of the leg and behind the knee, and then it inclines forward in the thigh and to reach the saphenous opening and pierce the cribriform fascia, and it drains into the femoral vein, and it receives tributaries as the cutaneous arteries. These are superficial externopudendal vein, superficial epigastric vein, superficial circumflex iliac vein. Then is superficial inguinal lymph node, which are arranged in a T-shaped manner. The vertical limb of the T drain the lower limb, while the medial horizontal there are two groups, medial and the lateral. Medial group drain the urethra, anal canal, and in female vagina, and the lateral group it drain the gluteal region and the lower part of the anterior abdominal wall. Then are the subcutaneous bursas. Bursas are lubricating mechanism at the site of friction. There are four type of bursa, but prepatellar bursa is important. Suprapatellar bursa, prepatellar bursa, deep infratemporal bursa, and subcutaneous bursa, and subcutaneous infrapatellar bursa. These subcutaneous infrapatellar bursa clinical anatomy is important, and prepatellar bursa is important because housemaid knee occurs. Usually the maids clean the floor by clean the floor with a cloth, and by their movement usually their knees touches to the floor, and the inflammation of this prepatellar bursa occur, and this is called housemaid knee. It is important for MCQ purpose. And then is Claryman's knees, which is inflammation of subcutaneous infrapatellar bursa. And one thing left, patellar plexus. This is MCQ. Usually this is asked in an MCQ question. Patellar plexus is formed by the anterior division of the lateral cutaneous nerve of thigh, intermediate cutaneous nerve of thigh, and anterior division of the medial cutaneous nerve of thigh. Infrapatellar branch of the saphenous nerve. Saphenous nerve, which is a branch of the posterior branch of the femoral nerve, also give the infrapatellar branch, which anastomose with the which form the patellar plexus.